So here's an interesting case for you. I had a patient that came in after being discharged from the hospital for 4 days. He was on hydroxychloroquine, and in addition to that, he was also on azithromycin. What happened is that he was doing very well, and after 4 days, he came back into the hospital after being treated for COVID-19. We thought that maybe he was having a stroke, and so that's why I was called to the actual case. He had altered mental status. So everybody was concerned that, okay, maybe he was having a stroke. But I noticed that he was having deep respiratory problems. And this is an interesting thought process. It seems that with COVID-19, you have this really good period where basically you're treated and you're in the hospital the first time and you get discharged. But then in this bottom period, it seems like everything will go well for about day 4 to 7. But then it hits and there's a readmission period, and that's where the dangerous period comes in. Now, I've seen some patients who have actually had strokes or some sort of issue with the brain. Then I've seen other patients that have respiratory distress problems. At the University of Kansas, there's this lady named Carolyn Aguirre, and basically what she's doing is she's testing the drug Losartan. And what Losartan does is it's an ARB, or an angiotensin receptor blocker. And what they're trying to do with this ARB is to reduce the incidence of severe acute respiratory syndrome. So there's a paper that was actually published back in 2018 that showed the efficacy of Losartan against severe acute respiratory syndrome, otherwise known as SARS. And basically, she's doing a randomized controlled trial, and in this venue, what she's doing is she's taking an arm of control and she's taking an arm of Losartan, and she's trying to figure out if this as an adjunct therapy can decrease the incidence of mortality. We'll find out more when the study is actually published. Thank you.